New year, new you. How many times have we heard that since the ball dropped on January 1st? What if it, for you, meant new you actually meant losing weight? You've thought about it, you've dreamt about it, you've even tried it a couple times with no success. Frustrated, you ask yourself, where do I start? Well, I'd like to introduce you to bariatric surgeon Dr. Samuel Yelverton with Lakewood Ranch Medical Group. Thank you for joining us today. I really appreciate that. Let's start with why people should look at Lakewood Ranch Medical Center and your program.
Yeah, so I think weight loss is tough. You know, not everyone can follow an exercise plan, follow a diet plan, and lose weight. There's so much more to weight loss, especially for people who have higher BMIs. And it's not just that. It's not one size fits all plans. And so at Lakewood Ranch Medical Center, we have a comprehensive weight loss plan, whether it includes diet and exercise, includes nutrition, the popular GLP-1 drugs, or bariatric surgery.
You and I were talking a minute ago, you know, when you hear bariatric programs or bariatric doctor, you immediately think surgery, right? And surgery is not the answer to everyone's journey. So, I mean, we were saying sometimes people just need that little push to start the ball rolling. Tell me about that.
Yeah, that's one of the biggest things I love about doing, whether it's the medications or weight loss surgery, is getting people that kickstart they need. Because so many people, especially the ones I see, they've tried everything under the sun, and it can be kind of frustrating. It can be, hurt the self-esteem, but to be able to get someone over that hump to where they actually start losing weight, they see the pounds come off, and especially for a lot of the people that we treat, they get rid of diabetes, high blood pressure, cardiovascular problems, or sleep apnea. They start to see those things happen, the weight coming off, and it just kickstart a whole new lifestyle, and it's fun to get to be a part of that.
Yeah, I was going to say, they see, their blood work that's all in the red, and then maybe after this, it's all in the green.
Yeah,
and they get that wonderful satisfaction of that. You pride yourself on personalizing each person's journey. So if I come into your office, what's the first thing that I can expect, or how do you personalize it for each individual person?
So I think the first thing we do, the most important thing is just meeting you, and then we kind of figure out your goals. We've seen what you've tried, diet, exercise, if you've tried GLP-1s and haven't had success, or other different medications, met with nutritionists, and then just kind of get to know you. I think the personalized care is the most important, because it's not, you just come see me, you're getting surgery. That may not be the goal. And to be able to understand your journey and what your goals are, then we tailor it using the medical knowledge we have and the resources we have to best fit that. Not everyone wants to lose 150 pounds. Some people want to lose 20 pounds. Some people want to stop taking their diabetes medications, or a lot of people just, they want their joints to feel better. And so to better understand what your goal is, that's where we start. And then we look at, how do you get to that goal? Sometimes it's a certain weight number, sometimes it's getting rid of a medication. It really just depends on what the goal is and how we can best get there with the resources we have.
And it's not as simple as walking in and being like, my friend Susie got the shots and she lost it. It may not be the same for every single person. We also talked about how some of these programs worked together well, whether the surgery with the shots or with the medication, or even just with the plan. So tell me about that.
Yeah, so I tell people, like, the first thing is, once I know your story and your goals, then we have to kind of put the plan together. And so the big thing that I like to do, a lot of people think, especially the GLP-1s, it's the magic bullet. It's, I'm going to lose all this weight. And I try and bring the realistic approach. Like with GLP-1s, you can expect to lose anywhere from 5 to 15% of your excess body weight. Some people, that's great. That's what they want. And then we have to have the realistic understanding of, that means a lifelong process of taking these drugs, because data would say when you stop them, you will gain the weight back. Not everyone's like that. Some people are able to lose the weight, then adapt a lifestyle and stop the drugs. But say you need to lose more weight, well, then bariatric surgery is typically it, because that loses 65 to 75% of your excess body weight loss. So it's much more effective for the people who need to lose more weight. And then some people just want to be plugged in with healthier lifestyles, and we can do that, whether it's set you up with a nutritionist, set you up with a physical therapist. Get those tools. That's not just, I'm going to go to the gym and I'm going to start eating less and counting calories.
It is such a comprehensive plan that you guys take care of, that's why I love it so much. It's not like you're walking in and you're signing up for surgery that day and that's what you're pushing. You're really taking the individual's needs into play and then creating a customized program that works best for them. That is such a a rare and beautiful thing that you offer. So if you want to learn more about any of this, go to LakewoodRanchMedicalCenter.com.